Good evening, everybody. My name is Dr. Vaibhav Joshi, working at UNMICRC Institute of Cardiology and Research Center as a cardiac physiotherapist. I am working here since more than 12 years. My today's topic of continuous physiotherapy education is exercise prescription in diabetes. We will start with the introduction. Diabetes is a metabolic disorder in which the body is unable to appropriately regulate the level of sugar, specifically glucose in the blood, either by poor sensitivity to the protein insulin or due to the inadequate production of insulin by pancreas. Type 2 diabetes account for 90 to 95% of all diabetes cases. In India, we can say about 70% of all global cases we have in India. We are accounted for 70% of all global cases, and India is called as a capital of diabetes. Diabetes itself is not a high mortality condition, but about 422 million people worldwide have diabetes. The majority living in low and middle income countries like African American or Indian American or Asian American, and 1.5 million deaths are directly attributed to the diabetes each year. Diabetes is also a major risk factor for cardiovascular disease, kidney disease and blindness. Pathophysiology. In pathophysiology, diabetes mellitus primarily affects the islet of Langerhans of the pancreas. Islet of Langerhans is a cell of pancreas where glucagon, basically from the alpha cells, and insulin from the beta cells are produced. Actually, islet of Langerhans have 4 types of cells. Alpha, as we said, which secretes glucagon, beta cells which secretes insulin, delta cells which secretes somatostatin, and P cells which produce polypeptide of pancreas. Glucagon raises the blood glucose level while insulin lowers it. In type 1 diabetes, insulin dependent actually, the loss of the function of the beta cells leads to an absolute insulin deficiency. In type 2 diabetes mellitus, non-insulin dependent, the impaired production and secretion of insulin and the beta cell is concomitant with the impaired ability to the tissue to utilize insulin, termed as insulin resistance. The resulting accumulation of glucose in the blood is further elevated by the greater synthesis of glucose in the liver, which releases it to the general circulation. In type 2 diabetes, both way, secretion of insulin and utilization of insulin both are impaired. This term called as a diabetes mellitus, we known as a non-insulin dependent. What are the risk factors? Risk factors are overweight, obesity, inactivity, sedentary lifestyle, family history, race, region, your age, gestational diabetes, high blood pressure, abnormal cholesterol and triglyceride levels. Those are the risk factors to the diabetes mellitus. Race, region we have discussed as a African American and Indian American, Asian American. Age is about 35 to more than years age have more prone to get diabetes. Gestational diabetes, a woman who get gestational diabetes are more prominent to get diabetes in later of life. High blood pressure patient, abnormal cholesterol, triglyceride level patients, those patients are more prone to get diabetes. Classical triad of diabetes mellitus are polydipsia, polyphagia and polyuria. In polydipsia, patient have unusual thirst. In polyphagia, there is a too much, patient eats too much. In polyuria, there is a frequent urination. There is also other factors like weight loss, fatigue with weakness, irritability, blurred vision, numbness or tingling sensation in hand and feet are also present. Glucose and ketone bodies are also present in urine. How we diagnose the diabetes mellitus? fasting plasma glucose level greater than or equal to 7 millimole per liter, we can say 126 mg per dl. Plasma glucose greater than or equal to 11.1 millimole per liter 2 hours after a 75 gram oral glucose load as in glucose tolerance test. Symptoms of high blood sugar and casual plasma glucose greater than or equal to 11.1 millimole per liter 200 milligram per dl. Glycated hemoglobin greater than or equal to 48 millimole per mole, 6.5% of. What are the major risk factors of diabetes mellitus? There are risk of stroke, loss of consciousness, visual disturbance, cataracts and glaucoma, risk of infection. Diabetic patients are more prone to get infection. High blood pressure, gastroparesis, pancreatic malfunction, fatigue and lack of energy, risk of heart disease also present over there. Extreme thirst, as we discussed, it's a because of polydipsia, and also sweet smelling breath because of ketoacidosis or ketone bodies. Excessive urination, damaged blood vessels, nerve damage and foot problem. As we see gangrene in foot also can see in diabetic patient. Dry and cracked skin because of polyuria, fluid balance may disturb and skin get ekdam dry. Ketoacidosis, protein in the urine. These are the major complication of management. In the management, we go through pharmacological agents and lifestyle modification and exercises. In somehow we miss the first line of treatment, lifestyle modification, exercise and diabetes. A sound individually tailored exercise prescription is a cornerstone in the management of diabetes mellitus. Structured exercise training consists of both aerobic exercise and resistance training exercises, or both combined of more than 150 minutes per week in association with greater HbA1c reduction in patient with type 2 diabetes than that of 150 minutes or less per week. What are the benefits of exercise in diabetes? Obviously weight loss, glycemic control and control blood pressure also. Enhance insulin secretion and sensitivity. Enhancing insulin secretion will benefit in type 1 diabetes, and increase secretion and sensitivity can benefit in type 2 diabetes. Improve physical fitness and fat percentage. Lipid profile balance, it can control, exercise can control lipid profile, restore the endothelial function and reduce arterial stiffness. Quality of life, give flexibility and muscle strength, gives you more energy and lean muscle mass. Bone mineral density, yes, it can strengthen your bone too, elevates mood and treat depression. Exercise may produce epinephrine and mood elevated hormones, which can elevate your mood and treat your depression. Improves self-confidence, improves cardiovascular function and coronary heart disease risk profile. Physical activity, any bodily movement produced by the skeletal muscle resulting in energy expenditure above resting state. It is called as a physical activity. And what is the physical fitness is a set of attributes that people have or achieve which relates to the ability to perform physical activity is called physical fitness. Metabolic equivalent, how much of O2 we are consuming, we can calculate then this. The amount of energy expenditure during exercise relate to energy expenditure at rest 1 metabolic equivalent. And in 1 MET we consume 3.5 ml of O2 per kg per minute. It is called 1 kilocalorie per kg per hour. As we seen diabetic triad, and this is a diabetic management triad in which nutrition, medication and exercise. These three are the triad of management. Through this, we can manage diabetes very well. Classification of exercises. This lecture is about exercise prescription, so we only see classification of exercises. Aerobic exercise, endurance type exercise, rhythmic, sustained for some time. Example, walking, jogging, cycling, running, swimming, etc. etc. Strength exercises means resistance exercise, weight training with free weight, TheraBand, TheraTube, calisthenics, machines, etc. etc. And flexibility exercise, which includes stretching exercises and yoga. Intensity of physical activity in light intensity, which conserves less than 3 MET, moderate intensity 3 to 6 MET, and vigorous intensity above 6 MET. All the activity above 6 MET are called as a vigorous intensity exercises. Moderate and vigorous intensity physical activities, we can say in moderate, brisk walking, recreational swimming, volleyball, tennis double, slow aerobics, moderate cycling, gardening, badminton, dancing, etc. etc. In vigorous intensity exercises, jogging, running, tennis single, basketball, skipping, rope, squash, fast aerobics, fast cycling, stepping, soccer and etc. etc. You can see tennis double has in moderate intensity exercises and a tennis single in vigorous intensity exercises, because it takes double energy in single. So we put vigorous intensity exercise in tennis single. In light intensity exercises includes walking slowly, playing pool, croquet, fishing, light household work such as cooking, dusting, ironing, folding. All are the mats are described in picture. 2 to 2.8 max mat are seen in picture. Moderate intensity exercises mats with mats, 6 mats in swimming, 6 mats in playing volleyball, 4.3 mats in bicycling moderately, 6 mats in playing tennis double. In vigorous intensity exercises, we can see the all pictures, 6 mat to 12.3 mats. Energy expenditure are showing running, jogging, playing football, playing tennis single, skipping ropes, bicycling fast, basketball. These are in vigorous intensity exercises. Amount of physical activity that promotes health. Moderate intensity physical activity, energy expenditure would be 3 to 6 minutes. That is greater than or equal to 30 minutes per day, more than 3 to 5 days per week. Thus, 150 minutes per week exercise promote health. That calorie expenditure would be more than 1000 kilocalorie per week. Many more research has been done in China, USA, Finland, Australia. Many of the patients showing results like moderate physical activity performed regularly for 120 to 200 minutes per week reduces the incidence of diabetes in people and predisposed to the diabetes. Recent latest guidelines by CSM in 2022, lead author Jill Kennelly recommends 5 more things to remember when being physically active with type 2 diabetes. Small doses of physical activity throughout the day to break up sitting time can have a beneficial effect on blood glucose and insulin level. Regular aerobic exercise, it helps manage blood glucose. High intensity resistance exercise benefits those with type 2 diabetes more than low to moderate intensity exercise. Being active after meals reduces blood glucose, while consistent aerobic exercise can help keep blood glucose in check. Working out takes energy. So those with type 2 diabetes should consider lowering their insulin a bit if they can, or adding in a few more carbs before they hit the gym to avoid crash. Either you take lower insulin dose or take some carbs before prior to gym or any activity. 6 tips for physical activity with type 2 diabetes recommended by the American College of Sports Medicine. Regular aerobic exercises, consistency would benefit it. High intensity resistance exercises, this type of exercise when performed safely will help more than low to moderate intensity exercises. Always be active after meal. Avoid crash during or after workout. People who use insulin should lower their levels or supplements with carbs to avoid a crash during or after workout. For those who are using beta blocker, please don't rely on heart monitor to measure workout intensity, or either you can take Borg scale or talk test for intensity. When to schedule? Always schedule your workout after meal, not before. Now, heart rate monitoring during exercises. Heart rate monitoring in exercise prescription is very much essential. Through this, we come to know exercise intensity and can cut down a cardiovascular risk factor. We can monitor our heart rate through a Karmanen formula. What is Karmanen formula? 220 minus age. Example, a 36-year-old with a resting heart rate of 78 would calculate as follow. 220 minus 36, 184 heart rate maximum. And his resting heart rate is 78. Would 106 of RHR and 60% is intensity plus 78 resting heart rate. Through this, we are getting 142 target heart rate over here, and intensity we are deciding for the aerobic exercises are 60 to 70%, means 142 to 152 would be his target heart rate. Exercise prescription in diabetes. Aerobic activity for 30 minutes extended to 60 minutes. We will extend this gradually. Or every day or most of day, we have target of 150 minutes per week. Exercise sessions should include 5 to 10 minutes of warm up, then exercise activity and 5 minutes of cool down. Exercise must involve most muscles in both upper and lower part of the body. Exercise must regular. Benefits are diminished after 1 to 2 weeks of stopping. Means consistency is a key factor. Modern intensity weight training program recommends to maintain muscle strength. Means 8 to 12 repetition 2 times per week. This is recommendation. For those with the feet problem, avoid running, jogging, alternate between walking, swimming and cycling. For those with feet problem, avoid jogging. Use proper shoes with silica gel or air-filled soles and always keep feet dry. When using insulin, avoid exercise if glucose level below 100 mg per dl or above 250 mg per dl. Do not inject insulin into a body parts that is expected to be used. Suppose we are going for upper arm activity and we inject insulin in our shoulder. Those injection will be restrict our mobility and function of shoulder. Avoid dehydration by keeping your body always hydrated. We have seen a triad, diabetes triad. We have seen polyuria over there. Through polyuria, there is a fluid imbalance also over there. So, we have to keep our body hydrated. Graded exercise testing for diabetes. It is recommended before any moderate to high intensity exercise, especially if age is greater than or equal to 35 years. Type 2 diabetes greater than 10 years duration, type 1 diabetes for 15 years duration, presence of any coronary artery disease risk factor or microvascular diseases like retinopathy, neuropathy or presence of peripheral vascular diseases. Exercise prescription for special cases. In special cases like diabetic with peripheral neuropathy. Peripheral neuropathy may result in loss of sensation in the feet. Repetitive exercise on insensitive feet can lead to ulceration, fracture or soft tissue injury. Limit weight bearing exercise, treadmill, prolonged walking, jogging, step exercise and etc. We should not do this kind of exercise. Alternate exercises are swimming, bicycle, arm exercises, chair exercises, etc. and use proper shoe and monitor the feet. Other condition, diabetic with autonomic neuropathy. This condition may limit exercise capacity and increase the risk of cardiovascular event during exercise. Hypotension and hypertension are more likely to develop after vigorous exercise. Those patients may have difficulty with thermoregulation. Avoid exercise in hot and cold environment. Means your patient may get heat stroke or hypothermia. Encourage adequate hydration. Hypoglycemia during or after exercise. It will most likely occur if the patient takes insulin or diabetic pills prior exercise, or he skips meal, exercise for long period of time, exercise strenuously. And what should be done to prevent? Patient must eat snack before exercises, adjust the medication dose, and remember, patient should always carry a source of carbohydrate with him, an apple or orange juice or a piece of fruit, or can carry a chocolate also. Earlier we have seen MAT values for activities. Now we are seeing energy cost of physical activity. Brisk walking 0.07 calories, running 7.5 minutes per kilometer, 0.30 consumption, running 5 minutes per kilometer, 0.208 calorie would be burned. As basketball, tennis, squash, badminton, and mat activity would be like walking slowly 2.5 mat, walking briskly 4 mat, running 8, swimming 6, weight training 6 mats, and squash 12 mats. From various activity, how we energy expenditure calculate? Suppose we are choosing a brisk walk. A person weighing 76 kg would expend 0.07 cross 76, means 5.3 kilocalories per minute. If he wants to expend 12,000 kilocalorie per week, he should walk 226 minutes, means 45 minutes per day per week, or 57 minutes per 4 days per week. Now preparing for exercise, proper warm up consisting of 5 to 10 minutes of aerobic activity. As we discussed earlier, activity session will be 15 to 30 minutes. If you are starting the session, start with 15 minutes, then gradually increase the time. Cool down should be structured similarly to the warm up and should last about 5 to 10 minutes. Before starting any exercises, we should go through a FIT principle. FIT principle consists of frequency, intensity, time and type. Frequency, minimum of 4 to 5 days per week we should done exercise. Intensity, it may vary patient to patient and should be tailored. For every patient, intensity is different. Time depends on exercise intensity and functional capacity of patient. Every patient has different capacity, can be divided into minimum of 10 minute bout throughout the day. If your patient cannot walk or brisk walk 20 minutes, you can tailor him and divide exercise timing by 4 times and tell him walk 4 times 5 minutes. Type refers to a sort of activity. Aerobics, strength training, flexibility, endurance. Either you are doing yoga. There is a sample walking program, 12-week sample walking program. If you are starting with 5 minutes of walking briskly, just walk slowly 5 minutes as a warm up, 5 minutes of walking briskly, and then 5 minutes of cool down. Again week second, 5 minutes of slowly as a warm up, 7 minutes briskly, and 5 minutes again cool down. With this we can go on week 12 and we can gain 5 minutes warm up slowly and brisk walk 30 minutes and cool down walking again slowly for 5 minutes. Through we can get 40 minutes of total exercise time through this kind of programs. There is also some recommendation and contraindicated for some special cases like peripheral and autonomic neuropathy. Recommendation are recommendation for peripheral and autonomic neuropathy are not weight bearing activities like swimming, cycling, chair and arm exercises, and contraindications are treadmill, prolonged walking, jogging and step exercise. Same way, nephropathy has recommendation and contraindication. Low to moderate intensity forms of exercise are advisable and high intensity form of exercise are contraindicated. Same as diabetic retinopathy, recommendation are low impact cardiovascular such as swimming, walking, low impact aerobic, stationary cycle and endurance exercise. Contraindication would be strenuous activities, pounding or jarring such as weightlifting, jogging, high impact aerobic, racket and sports. Hypoglycemia, as and when your patient getting symptoms of hypoglycemia, you should advise him to stop exercising immediately. People at risk for hypoglycemia should always carry a source of glucose tablet, candy or juice in order to treat hypoglycemia. Remember please, it is a medical emergency. How to prevent the hypoglycemia? Basic rules are: snack prior to activities to prevent hypoglycemia. Adjust quantity based on pre-activity blood glucose or reduction of blood glucose. If your blood glucose low or dropping, increase your intake of carbohydrates. If your blood glucose are okay, then usual carbohydrates. And if your blood glucose are high, decrease usual carbohydrates and snack at least once per hour during prolonged activity. Choose high glycemic forms of carbohydrate. This way we can prevent our hypoglycemia. And some useful tips: always tell your patient, always carry on identification card with you. Check your feet before you walk. Any ulceration or any laceration, any wound, we have to inspect every day with patient with diabetic neuropathy. Choose good footwear, light clothing. Don't exercise during hot season and when not feeling well. If your patient is sick, please tell him not exercise when you are sick. How physical activity helps you in type 2 diabetes? Physical activity lower blood glucose. Muscle cells become more sensitive to insulin. Keep the liver from producing too much glucose. Build more muscle, you lose weight and keep it off. How physical activities help heart? It strengthening heart muscles and improves cardiac function. It also control your resting heart rate, your blood pressure. It improves cholesterol. It reduces the risk of myocardial infarction and stroke. We now must plan physical activity schedules. हमने पूरी सेशन में देखा कि एक्सरसाइज या फिजिकल एक्टिविटीज़ डायबिटीज़ को प्रिवेंट करने में, डिले करने में या डायबिटीज़ के ट्रीटमेंट के दौरान भी कितना बेनिफिशियल है. एज एन कार्डियोवास्कुलर रिस्क फैक्टर्स भी रिड्यूस करती है. और जो भी हमारे आस पड़ोस के लोग हैं या फिर हमारे फ्रेंड सर्कल है, जो क्लोज फ्रेंड सर्कल है, उन सबको बोल के जो भी आपके ग्रुप में आए और उस ग्रुप को लेके भी आप ग्रुप एक्सरसाइज भी आप प्लान कर सकते हो. कब कैसे करना है वो आपके ऊपर है. नाउ चेक इफ़ यू आर over 35 year of age, have had diabetes more than 10 years, have high blood pressure, heart disease और poor circulation और other diabetic complication, और आपको फैमिली हिस्ट्री है या हैव sedentary lifestyle, you are major at risk. You should start exercising right now. Okay, thank you.